Hey, hope you're doing fine. My name is Usman Ghani. I'm a licensed physical therapist working in Toronto area, and welcome back to my YouTube channel, Muscle Tone Up with UG. This is a platform where you can find educational and informational videos on various muscle and joint issues. Our today's topic is shoulder pain or frozen shoulder, also diagnosed as adhesive capsulitis. A normal shoulder joint looks like this. The shoulder joint is enclosed in a capsule. Its internal thin membrane lubricates the joint. With the development of this condition, this capsule may get inflamed, and as the time goes on, it may keep on getting shrinking to restrict the movements. Exact cause of the shoulder capsulitis is not known. However, few risk factors have been identified, like it may develop more often in the age group between 40 to 60 years. It may develop more common in females as compared to males. People with diabetes are at more risk of developing this kind of condition. People with other medical conditions like hyperthyroidism, Parkinson's disease, or cardiac conditions may also be at more risk of developing this condition. Or if there is immobilization required after a surgery around shoulder, that might also be an increased risk factor of developing this condition afterwards. There are three stages of this problem. The first stage is freezing stage. The second one is frozen, and the third stage is thawing stage. Today, we will be talking about the first stage, the freezing stage. During this phase, the most prominent feature is pain. Pain is felt with any movements. Range of motion, though not much affected at the moment, but it keeps on decreasing to avoid pain. The pain is worse at night. This phase usually lasts in 6 weeks to 9 months' time. So the goals of treatment are very important to understand. As I mentioned, the main feature during this phase is pain, so managing pain is very important. We can do that with icing, with modifying sleeping posture, with the non-steroidal anti-inflammatory drugs, or one may also try steroidal injection as well. Second very important goal is to maintain as much range of motion as possible during this phase. As this condition is a long-term condition, it is important to know and understand well that it goes through what stages, how we can manage each stage. That will help with the perseverance and adherence to the treatment plan. For the sleeping posture, if one tries to sleep like this, that may hurt. Avoid putting the shoulder over the pillow. For a better sleeping posture, move the affected shoulder a little forward than the line of the body. It may help with the pain. If one tries to lie down on the non-affected side, they can use one or two pillows as required to support the affected arm and shoulder. For icing, put a paper towel on the affected shoulder and apply the cold pack on that. You may feel cold or very cold. If you feel like numb or burning, take the cold pack away for a few seconds and then reapply it. People with diabetes need to take it off after every few seconds to check the skin for redness and then reapply it. Apply it for 10 to 15 minutes, a couple of times a day. For the exercises during this stage, the first exercise, stand up like this with the unaffected hand on some support, feet apart, bend a little forward to hang the affected arm freely, and then shift the body weight onto each leg to give a pendular motion to the affected arm. Keep doing it for 1 to 2 minutes, a couple of times a day. Also try it standing like this and shifting the weight sideways on each foot. True pendular movements are thought to relieve pain. Then sit down just beside the table and put the affected arm on the surface. Slide the affected arm a little forward and then scooch backward in the chair. That may help to maintain as much range of motion at the shoulder as possible. Move very gently so it causes least or no pain. If the surface of the table is not very smooth, you can use a bin bag or any other mattress to make it smooth for easy sliding of the affected arm. Keep doing it for 10 repetitions, a couple of times a day, or at least once a day. That is to ensure as much range of motion as possible on the affected shoulder. For the next exercise, just stand in front of the wall, put your both forearms on the wall, and try to slide the forearms up as high as possible. If sliding the arms up causes pain, take the arms, slide the arms a little up, and then try to step back. As the arms are well supported, it may help to regain some range of motion or to maintain some range of motion with least or no pain. Keep repeating it for 10 times, at least once a day. For the next exercise, stand up just beside the wall and put your affected forearm on the wall like this and try to step towards the wall like this. That may help to maintain the external rotation range of motion at the shoulder joint. Keep repeating it for 10 times, at least once a day. Then put your arm on affected hand on the wall like this and try to turn away from the affected arm. Avoid moving too far away from the arm. This may help to maintain the internal rotation range of motion at the affected shoulder. If this position is comfortable, you can also try to slide your hand up on the back. Like this, to maintain as much internal range of motion on the shoulder joint as possible. Once the range of motion is taken care of, we also need to do something for the muscle strength. So start some gentle setting exercises. Lie down just beside the wall like this with the affected arm just close to the wall. Put a towel roll against between the wall and the affected elbow and gently push the elbow into the wall. Hold it there for 5 seconds and repeat it for 10 times, a couple of times a day. As you can see, it does not allow much movement, but a gentle muscle setting exercises can be initiated. You can use the towel roll between the wrist of the affected arm and the elbow and try to gently push the elbow into the wall. This may help to activate the external rotators of the shoulder. Just apply a very gentle force, hold it there for 5 seconds, and keep repeating for 10 times, a couple of times a day. And then gently push the elbow into the bed with very little force. Make sure it does not hurt. Keep repeating it for 10 times, a couple of times a day. Next one is put your non-affected hand's fingers against the palm of the affected arm, and then gently try to push the affected hand into the non-affected hand fingers. It means try to bring your affected palm towards your belly, but it is stopped with the other hand. Apply very gentle force, should not cause much movement. Repeat it 10 times, couple of times a day. All right, guys, I hope by following this whole treatment plan at this stage of the painful shoulder may help to reduce the pain and maintain also as much range of motion at the shoulder joint as possible. My upcoming videos on various topics. If you want to get them, please consider subscribing the channel and press the bell icon to get the notifications in time. If you like the content, give me a thumbs up. This platform is to provide educational and informational videos and for step-by-step management of various muscle and joint issues. However, this information is not meant to replace your individual advice from your healthcare provider. Hope it helps. Take care until next time.